health insurance, they can apply through their state to get into the federal high-risk pool. And this is typically people who have health problems. They maybe have a history of cancer, or maybe they have liver disease, or any number of things. Diabetes, there's any number of things that could be preventing them from getting insurance. So from now until 2014, there's the high-risk pool. Starting in 2014, there will be insurance exchanges. Now, we don't know a lot about the insurance exchanges yet, because that's one of the pieces that, again, we just have a framework, and they've got to, the Congress and the different organizations have got to figure out how they're going to put those exchanges together.
Also, this is sort of a state-by-state thing. So like in California, we actually got some enabling legislation, I think, this year to start to get an exchange put together.
Yes. So states can be doing their own thing in the interim, but the federal law, the exchanges are implemented in 2014, which is when the mandate to carry insurance goes into effect. So the framework for those is not in place. The high-risk pool, many states already had high-risk pools.
Right,
California is one of those. We still have our own high-risk pool, but the federal government, through this program, has kicked in an additional $2 or $4 billion into the entire system to all the states to help cover those costs. Virtually every state that had a high-risk pool was maxed out. There were waiting lists. You couldn't get into it because there just wasn't enough funding. And so the legislation adds additional funding. So the exchanges, we don't know a lot about them. They're supposed to standardize the insurance options that are being offered, so it's easier to compare what you're being offered and to shop around. And it also will provide a better mechanism for people who buy private insurance to be able to access that and be able to obtain their insurance. Now, the third way that they're getting people insured is actually the biggest, and it is anticipated to add about 19 million people to the rolls of the insured in the United States, and that's through the expansion of Medicaid. And basically, they are going to allow Medicaid to cover people who are not yet 65 years old and whose income does not exceed 133% of the federal poverty level. So it's going to bring a lot more people into the system. That's where the biggest impact is going to be. So depending on your political views, this is a good thing or a bad thing. You could see it as very socialized, because how we're getting so many more people insured is basically because the government's providing for it. So how do we make the people actually get insurance?
Yeah, how do we do that?
How do we do it? Guess who is watching out for this?
The IRS.
The IRS. That's why we're here on Financial Insider Weekly. It's the IRS. The IRS is the watchdog who's going to make sure that people maintain their health insurance. The way that they will be doing that is that the insurance providers will actually have to provide informational forms to the IRS that document who has insurance and the period that they were covered with the insurance. And if an individual fails to maintain adequate insurance, they will be fined. The fines start out fairly nominal in 2014, but very quickly go up over a course of 2 or 3 years to a fairly painful number.
Okay. Let's see here. I'm trying to gauge a little bit, because time is flying here, because Naomi is so eloquent. I've heard that healthcare reform extends the viability of the Medicare Trust Fund. Have they done that by cutting services?
Now, based on my comments about elders and seniors now being on board with this bill, what do you think the answer to that question is?
Of course
Mike? Exactly. They did not cut services to seniors. They've extended, on paper, they have extended from the accounting office, the federal accounting office that does these analyses, they have extended the viability of the Medicare Trust Fund, but it was not through cutting services. It's through a surtax on high wage earners. It's on for net investment income.
Right.
It's on a higher payroll deduction for your Medicare Part A that is taken out on your withholdings if you're a high wage earner. So people who are high wage earners, yes, they're going to be helping to subsidize this significantly. But all the guaranteed services under Medicare, they're still there. Mm-hmm. None of those have been cut. Where you will see a slight change or a significant change if you're on the program. If you are on Medicare Advantage, there were certain contracts that were providing excess services above what's required to be offered under Medicare. Mm-hmm. Those excess services are being eliminated in the years going forward. So if you're on Medicare Advantage and the company that offers it continues to offer it, which they may decide not to since they won't be able to make as much money, your services will be reduced back down to the guaranteed amounts that you get under Medicare. So that is the only place where there's really a reduction. Other than that, what you've got is everything else is still in place. The donut hole for prescription drug coverage is being eliminated. In fact, this year, if you fell into the hole, that is the terminology, meaning if you had prescription drug coverage and you used up the benefit and you were having to pay out of pocket, you're actually received already a rebate check in the amount of $250 from the federal government to help offset those costs. Going forward, it takes until about 2020 to actually completely eliminate that donut hole, but the most significant impact is actually going to be over the next couple of years, where the cost that people are paying for those prescription drugs while they're in the donut hole is reduced, I think starting next year, by 50%.
Okay. Can you talk really briefly?
No.
Okay. Moving right along.
I can try to talk very
no,
briefly.
I just wanted to hit this little, excuse me, it's kind of, the reason I wanted to bring it up is actually it's a major change, and that is this Medicare tax on investment income. So can you sort of describe what's going to happen, and then?
My extent, I have spent hours. I'm a lawyer, I'm not a number cruncher, as you know. I have spent hours trying to understand how that is calculated. I've worked through bunches of examples, and what I'm telling all of my clients and everybody who listens to me is if you are a high wage earner, if you have income of around $200,000, you need to talk to your CPA first, crunch the numbers, work through it, see if this impacts you, and see if there is any moving around of your assets that you can do to help mitigate that additional tax.
So when is the tax effective?
I believe 2014. I'd have to double check. What's your recollection on that, Mike?
Actually, I think it's maybe 2013. And anyway, and we're talking about, again, this is a tax on investment income that's going to be a Medicare tax. One of the concerns that people had was whether it would affect like the gain from a sale of a residence, the excluded gain, and the IRS has assured people it does not. Anyway, just be aware of it, and do spend some time with your tax advisor if you're in these higher income ranges, over a couple $100,000 for a single person. I think it's $250,000
Yes.
for married couples, because it is a significant tax, and so you'll want to do some planning.
Yes, it is. It's a 3.8% surtax.
Yeah, and it's a reason for thinking about, for example, this Roth conversion that's a big election that we're thinking about right now, because by moving that income up, then you may be able to avoid that tax, and in the long run.
Have you been successful at convincing clients to do that? I have counseled a number of clients who it would have been completely appropriate to do a Roth IRA conversion.
I have a few.
I have yet to successfully get somebody to recognize income early.
Yeah.
Even knowing that the taxes, the income tax rates were going up and that the surcharge was out there.
Yep. I do have a few, but not very many, because it's hard to get people to pay taxes sooner.
Absolutely.
Okay.
And by the way, you are right. It is 2013. I'm double checking my notes
Okay.
as we talk. The reason that that's hard to remember is because this bill is implemented over time. Some of it was effective within 6 months of enactment, and some of it's not effective until more like 2020. So as you're going through this, everything has a different implementation date. And so
Yeah.
it does make it very confusing and
Yeah.
hard to recall.
So how long does it usually take for you to give a presentation on this when you give your seminars?
When I do my seminars, it's typically an hour talking as fast as I can.
Yes.
And then people always have questions, and it's typically another half hour of questions and answers after we finish.
Okay. So the reason why I ask is we're basically about out of time. So what? There's either a highlight or maybe a final words of wisdom that you may have to offer related to this, and folks recognizing that there just isn't enough time to go into all of this in depth at this time.
What I do want to point out is that there are some really, really good resources out there. There are some bad resources, but there are some really, really good resources also. AARP has a very nice website, very user-friendly, easy to read and understand. And I have multiple copies of an article they put out about 6 months ago that summarizes the healthcare reform bill. I'd be happy to provide them to Mike. You can get them from him and we'll forward them to you. That would be fine. Or from AARP directly. There's also Kaiser Health News on the internet. That is the most comprehensive and reliable resource. They also have a really excellent, easy to read timeline for how the different pieces are implemented.
Okay. Naomi, thanks for being my guest. It's always a pleasure to have you on my show. And folks, as you can gather, this is an enormous piece of legislation, but there are some important benefits that are going to help many people, especially people who in the past haven't been able to get insurance, medical insurance and so forth, have had uninsurable conditions, or they've been over their limits. Hope you can join us next time on Financial Insider Weekly.
Should be a clock.
Don't worry about it. Look at me, I'll worry about the time. He does put a